Our top 5 things that we would like you to be very careful of if you're dealing with a hospital, especially over the age of 65. These 5 things can turn into complete disasters. And we are going to talk to you openly and honestly as 2 doctors who have seen these situations arise. And for anybody who enjoys our discussions, do check in the links down below. Make sure you've signed up for our separate Doctors of Ojais channel, where we post a lot of exclusive content, all related to your health and well-being. So we are going to count down here from 5 to 1. We're going to do it a little bit differently this time. I will go first. Number 5, medications. I want you to be super sure that the medical team knows exactly what medications you or a loved one is taking, especially if you're admitted to hospital in an acute situation. This is so important. Sadly, now we have a lot of what I call fake news because of computerized records, old medications. Maybe you have a story to tell of this and things will be transcribed over, but it's crucial that upon admission, your team knows your exact medications. They know the dosages when you take them. Maybe adjustments need to be made. And also, I'm going to give you a tip. Call the next day. This applies to a loved one. Call the next day and make sure the nurse knows the medicine that your loved one is on at home.
That's so true. And I see patients both in the inpatient and outpatient setting. And I can't tell you all the patients I've seen that come out of the hospital and their medications are completely messed up because when they got admitted, when the ordering doctor was doing the orders for admission, all the medications were not put in correctly. Some were left out. And because they were left out, no one is going to think that they should add it on. And it's really, really a problem. And I think that is a huge problem for other issues in the hospital that can happen. And it can be unsafe. It can cause an unsafe drop in your blood pressure if you're giving the medication that is too much. And it opens up a whole Pandora's box of problems.
It does. I mean, blood pressure is already over-treated in the hospital. People are running at very low blood pressures, but that can make it worse if there's the wrong medications being given, wrong dosages, or people haven't been on the medicine for years and then start having it in the hospital. Please be careful. That would be a huge thing for you to check up on in yourself or a loved one.
And if you don't remember your medications or you don't have a list coming in, what I've done as a doctor is I've called their pharmacy if it's still open at the time of day you're coming in, but have the doctor call your pharmacy. They'll probably have the most updated medications and they can check when it was filled.
Yeah, a lot of hospitals now have pharmacy technicians in the emergency room, which I think is a great idea.
It is a great idea.
Who will review the medications and make sure it's as accurate as possible. I would still advise there are a lot of places in healthcare where things can slip through the net, and this is a really big one. And fair enough, if the medical team needs to make changes, supposing you're sick and you can't take some of your baseline medications, at least they should know for sure what you are on. Another reason why this is a problem is even if certain medications are changed or held, upon discharge, boxes get ticked, oh, resume this medication. And people will say, I haven't even been on that medication. What do you mean, resume it?
Yeah. It could be a historical medication because remember in the day of electronic health records, doctors will copy and forward lists from other doctors. So just because one doctor put your medication list in doesn't mean it's necessarily the correct list. So you'd have to be your own advocate and you have to check it. And maybe that's a good time to look at all your individual medications to see, or do you need all these medications?
Yeah, it's a bane of my existence dealing with computerized medical records and medicines which patients are no longer taking. Wish we could go back to the good old days of talking to each other. And I like those old school doctors who would pull out their doctor bag and they would, in fact, a lot of time they would just remember the medications because we weren't in such a pharmaceutical dominated era. All right, Dr. Peter, we're doing a countdown. So number 4.
Number 4, delirium. So delirium is a change in your sensorium. It's not dementia. It's usually a reversible cause of confusion that we often see in the hospital in older people, especially with illnesses or prolonged hospital stays. And delirium is much more than just confusion. It's really, in a sense, brain failure in a setting where your brain reserve is overtaken by stress. And because of that, people get completely confused. And I'm sure if you've had a loved one in the hospital who's been sick, even with something like a urinary tract infection, and they've been in there for a number of days, they can get completely confused and losing where they are. They can believe that they're in some completely different place. They could sometimes think they're being kidnapped. the thing about delirium that is so key to avoid is that actually can double to almost triple mortality.
True.
So remember, when people get confused, you're not necessarily eating. You may get inadequate oral intake. They might not be eating the food that's given to them in the hospital or put next to their bed. People are confused, and rightfully so. They may think they're being kidnapped or in some danger. They may rip out intravenous medications, which can be harmful. Falls is a big risk too.
That's right.
So I imagine if you're really confused and don't know where you are, and you're in a hospital bed with a lot of wires, and getting out of bed can increase the risk of falling. And also aspiration, protecting your airway when you're eating. And if you are to the point of confusion from an illness, you can aspirate food into your lungs, which can lead to pneumonia. And there's just a whole cascade of events that can happen from that.
That's right. Yeah. This is a massive issue as well. So you have a loved one who's in the hospital. I'm going to take the patient out of the equation for a moment, because unfortunately, if a patient is confused, then obviously they can't be their own best advocate.
Sure.
But if you suspect that your loved one, whoever it is, your wife, your husband, your sibling, your parent, is confused, I want you to really go all out with the medical team. Why are they confused? What's going on? Can any medications be doing this? Do they have worsening infection? Are they dehydrated? Because as Dr. Peter rightly alluded to, statistics are terrible. If you have a confused patient in the hospital, that person is going to get more complications. And it's not uncommon. We see somebody who's perfectly healthy and independent in their late 60s, 70s. They have this bad hospitalization and they're in a rehab, get another complication in a nursing home before you know it. It's really sad. And that's something I would urge you to be fully on the ball with, while your loved one is obviously not on the ball, sadly confused. So thank you for that. All right, my one next, number 3. I want you to be very clear about who has ownership of the case. This is a very sad situation, and none of our discussions here are implying that doctors are bad people. I think doctors are very good people on the whole, who want to do the right thing. They went into medical school for the right reasons. Of course, there are some bad apples, but the majority of doctors just want to do a job, but we're in a terrible system. And this happens so often. Somebody will come into hospital with a complicated situation. There'll be multiple different specialists involved, but nobody will take ownership. Now, it should usually, at least in the United States, be the internal medicine hospital doctor that is in charge. But even that is sometimes in confusion. If you have someone who say has a cardiological issue, is the cardiology team in charge. If it's a surgical issue, is the surgery team in charge. There has to, as with any situation in life, we know this, there has to be a captain of the ship. You can't have, what's that phrase? Who's the chief and Indians? What's the phrase? Too many chiefs and no Indians? What's the phrase? I'm allowed to say this, by the way. I'm Indian. What is that? It's too many chiefs and something like that. But you get what I'm talking about. I was trying to use an American phrase there, but captain of the ship, you understand that. There has to be somebody in charge. And I want you to be really, really clear who's a doctor in charge. That doctor, this is a great thing about the US actually, as opposed to other countries. I can say in the UK, you won't always be seen by the senior doctor, but in the US, there is that expectation. The senior doctor will see you, get an update, who's in charge, what's going on, what's the diagnosis. In fact, a lot of the time we see, and this must be so frustrating. At the end of the day, this is about you, and share stories if this has happened to you. You will get, say, a lung doctor and a heart doctor, and the lung doctor will be saying the shortness of breath is due to a heart issue, and the heart doctor will be saying, no, it's a lung issue. So where does that leave the patient?
Oh, yeah, absolutely. I think the proper phrase or the terminology you're going to say is there's too many chefs in the kitchen. And that's how I phrase it.
Okay.
So, but I
Right.
think that, it's true. If there's too many chefs in the kitchen, I mean, who's the head chef here? And so my personal opinion is the hospitalist is the person who's admitting, and the specialist or the consultant. So there should be the gatekeeper. And this is sort of in primary care as well. When you go see your primary care, they coordinate your care, and there needs to be someone in control that coordinates your care. And that is a hospitalist, who is essentially an inpatient primary care. And ultimately, the specialists report to the hospitalist, and any questions, if the specialists aren't available, which they always should be, right? But in the case they're not, the hospitalist should be the one that all the information, but it's also the responsibility of the specialist to talk to the hospitalist to let them know. But you should be getting definitely daily updates on care. And it is so true that when there are complex medical issues, people pass it to each other, especially if it's not quite clear.
Mhm.
And it's really important to get updates. And if you're not getting the care you need or feel like you are not, getting updated, always speak to the nurses. I mean, the nurses are such good patient advocates. And I can tell you, they're always the best people to get that doctor back in the room, right?
They are. Yeah, it's understated. Too many cooks in the kitchen or too many chefs in the kitchen. What's the right phrase? Cooks in the kitchen? We're debating phrases here. But
Chefs.
yeah, you have too many people and nobody's taking ownership. That's the problem. And I completely agree. Nurses are a wonderful resource and they behind the scenes are really getting on the doctor's back. And I really don't like it when I hear stories of doctors showing disrespect to nurses or belittling their concerns. Nurses do an amazing job for being the patient advocate and frequently are texting and paging the doctors. And doctors have very busy days too, of course, but that's no excuse for not listening to nurses. Nurses say something is wrong. We need to get back in the room. We need to discuss with the patient and their family. They're very unhappy. Then doctors should do that. Absolutely. Should do it ASAP. I know you do. You're very good at that, Dr. Peter. So yeah, please make sure you know who's in charge of the case. All right. Dr. Peter, you're next. Number 2.
I always call this the window of opportunity. And what I'm referring to is your timing of discharge. And I'm not necessarily talking about early discharge because sometimes that could be dangerous. So when you're in the hospital, it's a time that you're going to be discharged. And I see this all the time, especially in older patients where they're due to be discharged. And maybe it's a Friday, but then people are like, it's a weekend coming up. How about this discharge to rehab on Monday? And what happens is some type of other physiological stressor or some type of infection can happen. And that window is totally moved out. And I see people who are supposed to be discharged, but then get pushed out by even a week or 2 weeks, or some people don't even make it out of the hospital because every single day you're in the hospital, you're exposed to infections. Hospitals are physiological stressors on the body.
Okay, everyone, I'm going to interrupt that awesome discussion for a moment. This is the really boring part where I tell you all about our expanding natural health and well-being store. So I will cut right to the chase. Check in the links down below. ohighwellness.com if you're in the USA, North America. ohighwellness.co if you're in the UK, Europe. As somebody who has taken natural supplements for my whole life, it has been a pleasure to work with a great team, formulating unique products, covering basically every body system, ranging from immune support, bone support, memory support, heart support, sleep support. We also have an expanding range of food and beverage products. Check out our protein thin snack, and we are expanding on our wellness teas. We've especially had some awesome reviews for our organic chai mix. All those links down below. Okay, back to the discussion. That is a superb one, Dr. Peter, the discharge window of opportunity. I always like to stress that hospitals can be absolutely fantastic for acute conditions, and fewer places, in my honest opinion, are better than the United States. You have a life-threatening emergency. It's fixed very fast. You get a lot of attention. But then after that, I always say, as soon as you're 40, 50% better, next step comes. Go home to recover, go to rehab, wherever, but don't linger in hospital even for a day longer than you need to.
No, hospitals, are great at acute care, but they're terrible at rehabbing patients and getting you back on your feet. So when you're physiologically resilient, I do believe that narrow window is a time that you can go home safely. You're in your normal environment. You have a lesser chance of all of the other things we talked about, of problems with complications from infections, lack of sleep in the hospital, increased incidence of delirium, which we know talked about increases mortality risk. And so it just goes on and on. But I see this all the time. So you have to be your own advocate. If you're a family member, make sure you talk with a case manager to make sure that you have an anticipated day of discharge and that it happens as long as the patient is safe to go home.
Yes, exactly. Yeah. Be very adamant with your team, obviously in a polite way, about when am I going to go home? When's the discharge date? What's the plan? And make it clear to your team that you are somebody that wants to leave the hospital. Okay, I will go next. It's a good follow-up from that. My number one piece of advice for you, if you're in the hospital, which could lead to an absolute disaster, is avoid sinking in bed syndrome. I'm going to patent that term, sinking in bed syndrome. And I am happy to talk about this over and over because right now in the United States, probably in many other countries, this is going on. What is this? Well, it relates to not moving enough. And it's because hospitals sadly underinvest in physical therapy staff, mobility aids. So let me paint a typical scenario for you. 72-year-old lady who was previously very healthy gets a really bad pneumonia, lung infection, comes into hospital, has sepsis, gets zapped with antibiotics and fluids, and is actually doing better by day 2 or 3. But she's not moving. She's lying in bed. And with each passing day, her muscles are getting more deconditioned. And I see this happen all the time. And frequently, sadly, family members often are begging me, saying, please get my mum out of bed. She's not doing well. And they shouldn't have to do that. And why this is so important is basically I have seen somebody who's fully functional end up in a nursing home within a few months because it starts this cascade of hospitalization, rehab, another complication. And it's all because when they were starting to feel better, they were lying in bed. And that's the worst thing for picking up more complications. So as soon as you're ready, and to be honest, a lot of the times the patients require a push to do this because they're still unwell, but you must get into the chair. You must start walking. I'm not talking about running a marathon, but just walk around the hospital floor a couple of times, walk in the room, even if you need a walker to help you. And ask the staff if they put you on a bed alarm, do you need to be on a bed alarm, especially if other people are in the room? Get moving, do some light exercises in your chair. If you have access to light dumbbells, maybe a family member could bring them in. But you must avoid muscular deconditioning because it will set you back. And you could easily, if you're over the age of 65, one infection, which let's be quite frank, anybody could get, could set you back and you will never be the same again. Don't let your muscles start wasting away. I speak from the heart with passion. You must not let this happen to you or a loved one.
So true. That's sarcopenia. That's the terminology we use for loss of muscle mass. And people lose tremendous amounts of muscle while in the hospital because you're right, you're not getting out of bed. So unless you're tied into the bed and you're not a fall risk and you can get out of the bed, it's so hard. I know that you want to stay in bed, but you will recover quicker. And I honestly think that people who are in prolonged hospitalization lose so much muscle mass. I often question if they ever fully recover from that.
Yeah.
And remember, your muscles are metabolic organs. So it's not just going to make you feel weak or tired, but your whole homeostasis of your body is thrown off.
That's correct. It's all thrown off, and it all starts with an illness and lying in bed longer than you should lie in bed. A very tragic situation happens all the time. And to be fair, it happens even at a young age, but there's a key difference. When a 21-year-old has this happen to them and gets sick, they can physiologically and metabolically bounce back really fast from that. They'll have a horrible time, but they will come back. But when it happens to an 81-year-old, the capacity is not there, sadly. You're already battling a lot. That's a reality of life. And I would say, if you're above the age of 65, just have it in your head. If you get sick or a loved one gets sick, as soon as you're able to, do not be stationary.
So true.
Thank you, everybody, for watching. We hope that was helpful. Hospitals every single day do amazing work in reversing acute illnesses quickly, but there are many areas where hospitals fall short. And that's the nature of the beast, if I can put it that way as well, because people come into hospital very sick. There are a lot of things going on and there's lots of opportunities for further things to go wrong. That's why you have to be the best advocate for yourself and for a loved one. We hope you enjoyed this discussion. Do share your stories down below. Check again in the links down below for our Doctors of Ojais separate channel and our natural health and wellbeing store, ohiwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK, ohiwellness.ie. If you're in Ireland or mainland Europe, we are very proud of our expanding range of natural health and wellbeing products, all formulated by ourselves based on compounds that we believe in and we consume regularly, including organic chai. Okay, take care, and we will speak in the next video.